My name is Guru Samaga. I'm the Executive Director at Blue Cross Blue Shield of Massachusetts, and I've been with the company for 5 years now. Here at Blue Cross, I am responsible for the digital transformation, including all members' digital interactions with Blue Cross Blue Shield of Massachusetts, including our mobile app, member portal, omni communications, email, SMS, push notification, customer interaction management, next best action, and more. In this capacity, I'm responsible for charting a unified personal member experience that fosters BCBSMA's mission statement of showing up for everyone like they are the only one. So we started our initial conversation engagement with Redpoint sometime in late 2020. At that point of time, our marketing communication was pretty successful, I would say. We were able to steer members from their shopping experience to enrollment to registering within our portals to sort of help them with their all operational needs. But we did see some gaps that sort of started impacting how effectively we wanted to communicate with our members. We were using multiple systems, multiple platforms for campaign management. It sort of siloed from a business unit perspective, and it was getting harder and harder for us to really understand the ROI of any given campaign, if especially they were spread across multiple business units. We were also facing a challenge of under communication or over communicating with our members. The experience that members were seeing at times were fragmented in terms of the message, the branding, the tone, the tenor, and all of this was sort of made us to look for a platform that could sort of help us from a HIPAA-compliant perspective, something that is flexible, something that's configurable, easy, relatively easy to implement. And we were looking a tool or a platform that could help us with not just the customer interaction management, but the next big thing of a next best action. And in order to do that, we sort of had outlined few key things that we definitely wanted to meet. One, we wanted the platform to be sort of aligned with the Gartner's HCEH, that's the Healthcare Consumer Engagement Hub framework. Sort of it's going to help us to be in compliance and sort of able to stay within the framework. We wanted to have a capability of an end-to-end tracking, especially when members' journey starts from shopping and the usage of our assets. We wanted to have a end-to-end tracking. We wanted to have a real-time decision-making capability, ability to reach our members with the latest and the greatest information that we have based on the members' engagement with us. We also were focusing on personalization. And with the personalization, we were also looking from a relevance perspective, at what point of time, what information, and how we want to communicate with the members. All of this, in addition to having a return on investment for any of the campaign, was at the top of our mind, and that's what we were looking for. I would say there are a few things that any leader can look from a value proposition perspective, right? There are going to be tangible and intangible values. And a lot of it has to stem from what's the company's vision from a personalized omnichannel experience that they want to offer to the members. And it has to start driving from that point, right? And any platform, be it Redpoint or others, they all need to sort of work and live in the broader ecosystem that Shannon was referring to. Any platform that you look for a value, what's the best way for us to get there? Now, if you want me to call out, I can call out a few quick things. One, look from an increased member engagement. With more and more members are tech savvy and they are comfortable having an interaction digitally with their payers or providers, it becomes imperative that we have some platform that can sort of help with scale and increase the member engagement. You can look from the perspective of an increased member satisfaction. More and more, we sort of send the communication which is proactive, which is predictive, and sort of helps with what member is looking for. Obviously, there are plans that many of the payers are coming up with, which are consumer-driven health plans, where those CDPs require members to do certain actions on their side for them to reap the maximum benefit of the plan. And in order to enable and support them, the digital engagement, the communications that we are talking about becomes a very critical component. There are administrative efficiencies. Any of these successfully implemented campaigns can reduce and will reduce the number of calls that goes to the call center. And all the participants on this webinar can easily think about what's the cost of reducing 1% of the calls going into the call center. Then there is that communication effectiveness, right? A lot of these communications, the way we do today, is real time. The data, the information is not stale, and it's relevant for the member at that point of time. And then overall, you have the operational efficiency in terms of having a platform that's a robust, scalable, single, centralized platform that can do everything is going to reduce the ET, IT cost and maintenance. Now, I want to call about what Shannon was talking about, right? I can't think of a situation where many of us are trying to adhere to the CMS changes about the CAPS rating program for 2024. Without having a platform like Redpoint, I don't think we will be effective in sort of trying to increase or raise the star rating. Redpoint is playing a critical role in this communication journey for us. What we did with the initial launch of the BlueFit campaign, we sort of collected all the information and sort of were able to showcase from a member's end-to-end journey perspective, the one that I talked about, what the critical things that we were looking for. And we were also looking at the personalization, how much members were reacting and responding to having more personalized information being shared with them. We had the dashboards, we had the reports in place for us to share with our leadership team, and they were able to see the true value of the implementation of Redpoint that we had done. Now, quickly on the heels of the BlueFit, we had lined up a series of initiatives. The next one we approached was sort of sending the explanation of benefits, EOBs, to our members, sort of trying to time it, make it personalizable so that there is more acceptance of when that comes, and there's a more click rate and sort of members are opening those communications. We sort of then went with the care navigation, which is sort of a bigger program for us within the BCBSMA, where we are sort of looking at a health effectiveness with the optimal cost for payers. How do we steer members towards a telehealth for wellness visits or a PCP visits? That's the next thing that we went with. And while we were doing these initiatives, we were also sort of enhancing and building the capabilities that I talked about, the tiles, the dynamic tiles that we were showing to our members. We were enhancing the capabilities on that, and we started integrated that with the inbox within our portal, where we can steer the members on more relevant information that's always available. They don't have to go back and look at an SMS or an email that they had received. And an interesting use case we encountered at the time is there were still a lot of our members in other plans, specifically on the Medicare side of the world, where they were still preferring the postal paper mail for all the communication. Now, when we were setting out to have a centralized all interaction management platform, we sort of had to create a campaign within Redpoint, though it was not digitally delivered. Any paper vendor who was sort of sending it as for third-party vendors who were sending the communications on our behalf, we sort of steered all of that to go through Redpoint. So in a sense, even though the postal paper mail reached the members, we were able to see what communication has been sent to them. Now, since the time we started, all our commercial customers, Medicare, corporate communications, the FEP, the pharmacy, all those communications are all centralized and are orchestrated through Redpoint. Just to sort of say how far we have progressed from the time we started in 2022, we have about 155 active campaigns orchestrated through Redpoint today. We have sent over 4.5 million email communications, 400,000 SMS communications, 3.2 million inbox messages, and more interestingly, 1.5 million paper campaigns that I talked about in the last. They're all orchestrated and managed through Redpoint. Now, we are at a point where we want to sort of push the envelope and start using the next best action capability of the Redpoint.